Everybody, and welcome to the medalist today. I've got these things on, Donna. I'm not wearing earrings. I did have a niece with a birthday recently. She did get earrings. She was very brave. I guess the first stab in there was a lot of pain. Second one, she didn't even notice. So she's really tough at 5 years old and just rocking it. So hey to Oak if you're watching. And then the other thing that I've got to show you. So I've got my WSU cup like I usually do, but the other side. I've got my dinosaur stickers, right?
Oh, there you go.
Ankylosaurus down here, right? And so the one fun thing is the boys are like super into dinosaurs, but for me, it's so funny to look at them because as I was a kid, like none of them had feathers, but now there's new ways to look at dinosaurs and new kind of theories, that are kind of out there. And it reminds me a lot of, me going through pharmacy school and then going into hospital medicine, et cetera, and seeing the ways that we've looked at cannabis change and evolve so quickly. Like something that at one time was saying, hey, here's a lot of problems going on here, and it's totally restricted to in Washington State. It's very wide open and legal, for lots of folks to use. And now the medical community is really trying to catch up. What about for you guys? Anything fun? Is anybody in the family into dinosaurs for your side, or any other cannabis anecdotes?
We're way behind, or way past the dinosaurs, I should say. But yes, we all went through the dinosaur phase. But no, I think you're right, Kevin. I think in Massachusetts too, it is legal for cannabis to be available and dispense um, facilities too. So it's really interesting to see this evolving, and I'm excited to get educated today too. So we will do
I,
that.
I totally agree. Yeah, I mean, for a stat for our audience, just so you can kind of realize like the magnitude of change over time. And so when I was in school and graduated was right about 2012, and so right into that there were a ton of changes with opiate utilization and cannabis. And as you can see here, right around 2016 is the percentage change, but it has changed from more than 600% increase in users of cannabis out there in the world. So can't bury your head in the sand, as Marissa was really talking to us, beforehand. And that's a difficult thing to say though, Donna, because so many folks that I've kind of worked with over the years, and I'm sure you too, say, well, the regulations make it difficult for me not to bury my head in the sand when it comes to things. So I'm really looking forward to talking to Marissa about her expertise and how we can be a little more clear on those things.
Yeah, I'm excited too. So, hi, Marissa. Thank you so much for joining us today. I just wanted to share a little bit about you with our audience. So today we have Marissa Fratoni with us. She's a BSN-RN, and she's experienced health professional and wellness advocate with over 20 years in and integrative and conventional healthcare. As a registered nurse, she specializes in mental and behavioral health, women's health, and community health. Marissa is also a registered yoga teacher and mindfulness leader, a passionate educator and plant medicine advocate. She contributed to the first cannabis focused nursing textbook, Cannabis, a handbook for nurses, and champions holistic approaches to health and well being for all humans across the lifespan. And I love that. Yes. I'm so glad you have your book with you. That's awesome.
Me too.
And I have me.
Right.
So welcome, and I'm so excited to dive into learning about you and learning about your journey to nursing and then through nursing and now being an advocate and helping nurses and healthcare professionals in general learn about cannabis use, and how we should be accepting this and working with cannabis.
Sure. So, my background, I mean, I've been a holistic health practitioner for a very long time. I actually started my career as a massage therapist. And massage therapy really helped me to understand that my body was going to wear out very quickly. I wanted to work more intensively and broaden my scope with patients. I really, loved it. So I chose nursing. I could have chosen a lot of different things, but I chose nursing. I felt that was the broadest scope for my interest. And I did. I went to Fitchburg State University here in Massachusetts. And I actually started my nursing career in the least holistic place in the entire medical field, which is the operating room. And Yeah, a little weird, but I'm an anatomy buff, so that worked out. But that after a couple of years, that wasn't for me, and I found my home in behavioral health, mental health, community nursing, and that I did that for a number of years. I was visiting people in their homes. I was able to see how they lived. I was able to see what their challenges were. I saw a wide variety of patients. My OR experience came to good use because I did a lot of wound care at that time. So I was also doing some medical surgical visiting nursing as well. And that's sort of led me to learn that patients were using cannabis and having some really remarkable effects. One of the patients I had, when I met him, he had a diagnosis of end-stage Crohn's disease. He was struggling to eat. He was really wasting away. And I thought that, he was going to be admitted to hospice. I was only seeing him per diem, so I would see him every now and then. And then I noticed he was on my list again, and I was a little surprised. And I remember visiting him, and he looked a little bit puffier. I'm like, "Hey, are you gaining weight? You look," and he had more energy. And then he told me that his brother finally convinced him to smoke some weed. And I was like, "Okay." I was like, "Tell me about that." And he said it was the first thing that gave him any appetite. Everything that he had tried prior to that was not working. And he had a half a grilled cheese sandwich, which he actually craved it. He ate it. He said, it tasted good. And it really changed. It turned him around. And it got my attention. And cannabis for me was never, I had hippie parents. It was never like it wasn't the gateway drug. It wasn't I grew up, sort of around it. But to see it in a medical capacity was very intriguing. And I wanted to learn more. So I actually took a job at a medical dispensary when the medical program got going here in Massachusetts. And I did that for about a year. I saw patients that I call them unicorns. They had diagnoses that were just very often intractable, not well managed by what the medical system had to offer them. Most of them ended up coming to cannabis because they had no other options. Mm-hmm. And some of them were, I don't use this liberally, but some of them were miracles, just straight up. There are people that were supposed to be dead that continued because they were using cannabis. And don't get me wrong, at the time, there were a lot of people that were just going to get their medical card so that they could access cannabis and use it recreationally. And that's totally fine. That's up to, whatever. But the medical aspect of it was just, I sort of became obsessed with it. So I wanted to dive deeper. But I sort of jumped first into the medical cannabis space. So I was like, I have a nursing license. What does this mean for me? So I found a organization called the American Cannabis Nurses Association. And I found other nurses like me who were doing the thing, as we would say. I met a lot of nurses who had been advocating for patients for decades, sometimes 40 years. Wow. Nurses that had taken care of people during the AIDS crisis. Nurses that were taking care of people, marginalized people. So I dove into that and I learned a lot from them. I learned a lot from these nurses that were just pioneers, warriors, people that just, they didn't care so much about all of the restrictions on, legally regulatorily, they were seeing what I was seeing, which was patients were getting better with the use of this medicine. So yeah, that's pretty much how I got here. I continue to expand my role with the ACNA. I did serve on the board of directors. And then through there, I met Dr. Carrie Cadu, who is formerly Dr. Carrie Clark, and she was the editor for this textbook that she was putting together. She was the past president of the ACNA, and she was seeking nurses who could write, and I'm a writer, and she asked me if I would share my experience for Chapter 9, which is titled The Cannabis Nurse Experience. And so she had reached out to a bunch of us that were in practice and asked us to share our real world experiences. So that was the chapter that I helped to write. I was the lead writer on that. But very proud of it. It's a wonderful work.
So
Very interesting.
I'm almost a little speechless right now, Kevin. I don't know about you, but I'm just wowed by the passion that's coming through, and you can hear like what you've learned and learning from others that really have tried to advocate before you even became interested in this. Nurses that have been practicing for years before you. So it's great to have those mentors too, and you can tell you appreciate them for sure.
I do, and I want to be clear. Like some of these mentors they were in prison. They were imprisoned for this advocacy. So those of us that are in this movement now, we stand on the backs of giants. Wow. So they lost their freedoms. They gave up everything for their beliefs in the movement.
Wow.
Yeah.
Amazing.
That's such an interesting space, Donna. I think in general, like there's so many opposing thoughts that I have just like floating in my head when Marissa's talking about like all the benefits, right? Because there's been so many publications and so many papers talking about all the problems related to utilization of cannabis, oftentimes in recreational settings that we're seeing problems pop up. How Marissa, do you help educate the folks and kind of work through some of the stereotypes that either cannabis utilization has earned or inappropriately been labeled with over the years, and kind of balance the benefits you're seeing anecdotally with some of the papers and publications that you're seeing out there in space?
Yeah, I think there is a lot of stigma. And I think, what I try to do when I'm faced with stigma is I just try to, put a little bit of information on the line. I understand that it's sort of like, there's a lot of metaphors that we use in the cannabis space. You got to plant seeds and then give them a little bit of water over time and maybe some sunshine, and they'll start to grow. And that's what I do. I meet stigma with information. Sometimes if they're open, I'll give them a resource. And then I'll let them know, like, if you want to talk about it, I'm happy to connect. So I try not to be forceful. A lot of people don't even understand where their sort of understanding of this plant comes from. And a lot of people also really bought into the war on drugs. They really brought into the propaganda that was, was in commercials for years. It was just put in front of us for a very long time. And it takes time and patience and diligence to sort of undo, what the propaganda can, sort of create in a mindset.
Yeah.
Why do you think that was all lumped together for you, Marissa? The war on drugs you're, kind of talking about was methamphetamine, heroin, so many other components, and then cannabis is put in there as well. And once again, I'm not saying that I'm not acknowledging all the papers that are showing there are problems with cannabis for certain patients in certain settings and certain mixes of THC. But at the same time, we had another interesting war that was against kind of pharmaceutical companies when we had an opiate epidemic, right? And we ended up prescribing that as a fifth vital sign for pain. And we saw how problematic that was for society. In fact, we're still paying for that in a pandemic way right now, that I can literally turn the news on and see another opiate overdose happening. So much so that I advocate for everybody to get Narcan and understand how to utilize it in their communities, because it's so important. So we see all that kind of lumped together, and we see some of the things that are in place that are true, right, about the way that cannabis was being utilized. When you said resources and things for our audience, both clinicians and patients, what are some of the things that you would say, there's always those folks that are radical on both sides, right? And so speaking for the individuals that are maybe pushing cannabis much further than you would like as a clinician, like saying, here's where the science is, here's where the studies are, here's where the good evidence is in the utilization. How would you bring everything back to kind of the center to show here's where it really should be and make sense for patients and clinicians?
I mean, I think we need more regulation. I mean, it needs to be better regulated. We need, we need the laws to change. The federal government needs to, frankly, it needs to be, I'm an advocate for descheduling it. But I think, I don't know, we'll see. We were talking about rescheduling, and I think my guess is that's going to be shelved. It's probably not going to be a priority anytime soon. But we need to get cannabis out of the Schedule 1 status. It absolutely has its risks. It is nothing like heroin. It is nothing like methamphetamine. It was lumped in there because of, frankly, prohibition that was, it has a deep integration with racism. So Richard Nixon, really, the Controlled Substances Act, cannabis especially came about into that Schedule 1 status because of racism. And we can follow it back to the 1930s when cannabis prohibition started. It was a movement against Black jazz singers and indigenous cultures who used cannabis. There's so many nuances to it. There's so much history to it. But yeah, cannabis prohibition by and large is a racist movement. And that's the reason why I wanted to just say the reason why I'm saying cannabis is because that is the scientific term for it. It's cannabis sativa. So marijuana is a term of racism. It's a racist slang term.
Fascinating. I'm gonna have to look more into that for sure. The one thing I hope you can educate our audience on even further is you mentioned Schedule 1, right? And that was one of the things that I encountered very early, Marissa, in providers that wanted to utilize something, or their patients were already using an edible substance, a cream, whatever the case was when it came to the hospital. They were looking at their DEA license and they said, Kevin, like, what can I do? Like, I'm in a rock and a hard place when it comes to prescribing other things, having, oftentimes THC monitoring, right? Or CBD monitoring when it came to their patients utilizing these substances, and that not allowing them to prescribe other things for their pain or whatever else came along the line. So there's a real rock and a hard place, that clinicians are put in. Can you explain a little bit more about what Schedule 1 means and why it's so problematic with bringing anything in the cannabis world into play for clinicians?
Sure. So Schedule 1 substances are not these substances, again, heroin, methamphetamine, cocaine. No, cocaine's actually not in it, but certain uses of it are. And a lot of people don't know that. Basically, these are drugs thought to be highly addictive, very dangerous, and they can't be prescribed. So the loophole that the cannabis industry has gotten through on, especially the legal through the legal states, is that it's recommended. It can be recommended, but it cannot be prescribed. So yeah, but if you look at all the drugs, I mean, mescaline's in there. If you look at all the drugs that are in Schedule 1, if you list them all out, cannabis is sort of like, it's like the redheaded step brother. It's like, what? So or stepsister. It's a girl. So,
There you go. There you go. Yes.
So yeah, it's just, it's unfortunate, that, you know, it has, such a, there's so much complexity to the plant itself. It would be wonderful if we could actually research it.
Oh, it absolutely would be. And I think you said Schedule 1 research. I mean, even methamphetamine has a Schedule 2, right, designation for
Yeah.
utilization. So there's lots of drugs that, you know, as we can see here. So here's a map that Marissa and I and Donna were talking about prior to. It's from the CDC. It's really looking at the different cannabis regulations throughout the United States. And the differing colors you can see there show how, as I was saying, how brutally ununited the states are when it comes to cannabis utilization, right? The laws, the governances from state to state, and what can really be done for individuals. So you see that, you know, the lightest blue, they have no public access. The medium blue there is adult medical and non-medical cannabis programs. In Washington State, there's recreational, you know, cannabis utilization, and then medical only cannabis programs, you know, are oftentimes we're seeing in the southeastern United States, right there. Marissa, what does this do? You know, when it comes to adding, we talked about regulations at the federal level. What does the state regulation, you know, start to really throw another wrench in, leveraging what could be a very effective therapy?
I mean, that's just, you know, the state policies, they're like snowflakes. No two are alike, you know, and it's super confusing. You know, it leaves people, it leaves people in precarious situations. I mean, before we've had this expansion now across the states, you know, and it expands, like, I think we're up to 40, I think the last count was 41. So we're getting there. But, you know, there's a lot of people, like, say, you know, I'm based in New England. There's a lot of people that don't know, like, you're not supposed to cross state lines with your cannabis. Like, but, you know, if you're in Massachusetts, you're going to the beach, you're probably going to go cross into New Hampshire or Maine. You're going to go to the, you know, so, there's it just leaves people in the crosshairs. And like I said, no two states are alike. So, what one state might have, a lot of cannabis patients face this. Actually, they try to navigate because we have the adult use programs now. So you can go to an adult use program as a patient, but a lot of people, say in Massachusetts, where we have a very flush system here. We've got a lot of products. We've got, like, you know, we've got any delivery method that you could think of here. But say you go south to, like, Virginia is a good example. There's a lot of people that depend on cannabis medicines, and then they try to abide by the regulations and the law, and they go to a different place and they cannot find the same products that they depend on for their condition. So some states, sure, they have a medical program, but those are like CBD only states. And then some places too, there's still, like, a lot of southern states, even though there's technically a state program, the federal law can supersede that. And, you know, when we talk about people that can get in trouble there, they tend to be Black and brown people. So it's still happening.
Yeah.
So yeah, this is what we need is for the federal government to get involved and then change it, and, you know, to change the law, get this drug out of the Controlled Substances Act, and let the people that can oversee it, pharmacists, healthcare providers, you know, people that really understand substances, let those people have the reins so that we can protect the public in the way that the public deserves.
Well said.
So Marissa, I would love to get into, you know, what is approved, or, if you will, where do you find that cannabis works best for? So what types of disease states and conditions, and what have you seen in your practice where, this seems to be a viable use for cannabis?
So pain, a lot of people use cannabis for pain. And they're typically using it because, cannabis is a highly anti-inflammatory medicine. It also can change the sensorium experience. So people, when they're in pain, they're usually depressed, they're not feeling well. It can lift their mood. The THC will lift their mood and help them feel better. And a lot of times that energizes them enough to help them function. Wasting syndromes, I think cannabis is really important. It's we have a Marinol, which is a synthetic THC on the market. And it's just, my father, he had lung cancer. He succumbed to it in 2020. But I remember we got him a prescription for Marinol, and he described it as, he's like, all of the side effects and none of the fun. So he had dry mouth. It didn't really stimulate his appetite. He didn't really feel very good on it. I'm like, all right, Dad, just have it, whatever. I was like, don't inhale too deeply. Let's see. So intractable seizure disorders. There's a lot of people in the world that use cannabis to manage their seizures. There's some really incredible advocates out there that have had, there was one that she was having seizures, I want to say somewhere in the neighborhood of like 20 a week, and hasn't had a seizure in over 5 years with the use of cannabis. So Crohn's disease, I mentioned that earlier. Again, that wasting syndrome, stimulating appetite is really incredible. There's a lot of information coming out about helping older adults with dementia and Alzheimer's disease, not necessarily giving them, major cannabinoids like THC, but the more minor cannabinoids like CBD, cannabidiol, cannabigerol, CBG. There's a lot of people who are working with this plant and helping this population, and they're finding that it's helping them with sundowning, it's helping them eat, it's helping them not be so anxious and fraught with their symptoms, and sometimes even giving them periods of lucidity and cognitive clarity. It helps people that have had concussions. It's a neuroprotective medicine. It's people that have had stroke have used it to protect, neurodegenerative effects. Lyme disease, that's a big one that I've seen in this area because we have an endemic community. Again, that highly anti-inflammatory medicine. So really great for that joint swelling and inflammation. Glioblastoma, I mentioned that because I've had a few patients with it, and of course it's a tough diagnosis. But for the families, especially as it's really progressing, I've had now four different families say the same thing, that it brought their loved one back for a little while. Let them be present, let them laugh, let them have some family time. I know PTSD. PTSD, yeah. A lot of veterans use it.
I've seen a couple papers on that. But the one thing you're talking about there, Marissa, that I'd love for the audience to know, because in Washington State, someone can come into a local pharmacy and find a cream, an ointment, whatever the case may be. Oftentimes there's some edibles that are out there, but they'll talk about CBD and THC. And you mentioned a few other, chemicals that are in there. In fact, I think there's like over 500, there's probably more, over 500 distinct chemicals, right? You have a very complex plant. So
Mhm.
when educating, the layperson on these various chemicals that can be inside of a product, and then also you mentioned Marinol, which was CBD alone, the Epidiolex that's used for seizure. Once again, there's another option, it's FDA approved. Give us some insights when it comes to simplifying things, either from a patient's perspective or clinicians, when it comes to understanding these complexities and what they can be used for.
Okay, so THC, tetrahydrocannabinol, is the high creator or the happy creator. It's the one that's most well known for creating that euphoric feeling. The one that is characteristically, stereotypically known as, like, that when people think of stoners and laughing and
Sure.
munchies and all that sort of stuff, that's THC doing that. It
Got it.
is what is one of the primary cannabinoids in the plant. And then there's a whole bunch of minor cannabinoids. So the plant itself mediates itself. Cannabinoids, as it grows, as they differentiate, there's always a concentration of these various cannabinoids. So the one that's been bred up over the years is now cannabidiol. That's the second most popular cannabinoid on the market. And that one is a non-impairing cannabinoid, but it is psychoactive. So a lot of people say that cannabidiol is non-psychoactive, but that's not true. It absolutely does have an effect.
How does that
It
vary
has
from
an
THC?
So THC creates more of a, it is a, I don't like saying this, but it is a very minor hallucinogen used in large amounts. It can create someone's, it can create a very euphoric state. It can help people, sort of alter their reality. Whereas CBD is not going to do that. It's going to, but it could lift mood. It can create, someone who's feeling anxious, it could make them feel calm. Someone who's feeling depressed, it could lift their mood a bit. So it's CBD specifically is very popular with older adults because it doesn't create that effect that a lot of older adults don't want to be high, frankly.
Yeah.
And then there's a whole bunch of other cannabinoids.
Yeah. Oh, totally. And I think it's just so interesting when you're kind of breaking this down for us, Marissa. There's so many treatments we're seeing popping up, non-cannabis treatments that are being used for very similar kind of components of their mechanisms of action. So drugs have a mechanism of action. They rely upon how they bind to given sites and have an effect within the human body. One example is ketamine. Once before was, once again, another street drug used now in hospital settings oftentimes, and in infusion settings for intractable pain or depression or other things that are related to some of the euphoric components of giving that long-term injection. So it's really fascinating, I guess, for the medical community to better acknowledge that there are a lot of comparators to what we're utilizing cannabis's multiple chemicals to, and the other things that are used common practice that we're just not doing enough of because, as Marissa points out, the regulations just haven't allowed us to.
Yeah.
Marissa, can I ask about, is MS another area where cannabinoids are used? Could you do you know a little bit about that? And is it earlier on, later on? Is there a specific time where it's more beneficial?
So in the UK, there is a product called Sativex, and it is indicated for MS-related spasticity, and it is I believe it's a 1-to-1 intranasal, or perhaps you inhale it, but it is it's effective. So yeah, here we don't have not, at least I can't see, again, that constellation effect of the different state programs. So I can't say for sure that it's not here. It probably is somewhere. It's probably in California. It's probably in Washington. But we here, I know in Massachusetts, in New England, we don't have necessarily a similar product, but we do have a lot of patients with MS who are using it for a variety of condition, of their symptoms. Spasticity being one of them, pain being one of them, mood just being another one. And I also have a patient who it was the only thing that helped her sleep through the night. So, yeah.
Wow.
So, I'm curious, like thinking about what you were saying, all of these areas that you might treat, and think about the older adults, MS, other things. I do know like children that use it for seizures, right? Isn't that one of the approvals? But in general, is there a certain age where you would that there's a cutoff almost, either early on or even later on? Like, are you seeing any kind of age appropriateness, or does it not matter?
Oh no, there's definitely so with the pediatric population, the idea with cannabis in the pediatric space is that if you have an intractable disorder like a seizure disorder, cancer, if you've got a disease state that could be treated with cannabis, then go ahead and do that. But even then, typically with normal, healthy, developing children, we don't want their brains exposed to THC, especially ideally before the age of 26. So when the prefrontal cortex is fully developed. But generally speaking, when I'm talking to teens, and I do talk to teens, I recommend that if they can stay away from substances across the board, vaping, THC, alcohol, protect their brains, let them grow, to be fully developed and healthy. Try to get them at least past 21 years old. And a lot of teens are going to go, I'm not doing that. But we do know that there are negative impacts for the developing brain when cannabis is used at a young age. So, and some of the stuff that we do see is, especially if I believe it's like before 16, they're more prone to having generalized anxiety disorder. They're more prone to having, sort of the conditions that they were trying to self-treat, self-medicate. These conditions become persistent into their adulthood. And of course, a lot of adolescents, they think they're bulletproof. Nothing's going to happen to them. They're not going to be the one. But again, planting those seeds. Sometimes I do ask a young person, why are you using your vape? Oh, because I feel anxious. Like, okay. I was like, did you know that if you continue to use it in the way that you use it, that you might feel like that all the time? And it could be something that is hard for you to get rid of when you're older. So again, it's not like they're not going to go like, okay, I'm going to stop now.
Right.
But planting those seeds,
Very smart.
And
hoping for the best.
So, and then what about the other side? I know that you talked about the cannabis being used in older adults and then also for Alzheimer's, et cetera. But is there a certain time or a certain where you'd say, no, probably not, or does it not really matter?
My oldest patient has been 99 years old.
Okay.
But there are some stuff that you want to be, some diagnoses that you want to be really clear on. If they have a heart condition, they need to be working closely with a healthcare provider that is cannabis literate. They should avoid certain delivery applications of specifically THC. THC can cause tachycardia, especially inhaled versions, but also, cannabis stimulates the sympathetic nervous system. So whether you're delivering it via inhalation or eating it, chances are you're going to have your heart rate is probably going to go up when the cannabis on board peaks. And again, that's THC driven typically. So yeah, heart conditions. And then there's certain medications that we got to be really clear on, because CBD especially interacts with most of the pharmaceutical and over-the-counter medications on the market. It can increase the amount of medication in the bloodstream. It can decrease the amount of medicine in the bloodstream. It's not harmless. We've got people that are on, like, if you've got blood thinning medications, for example, they should be staying clear of cannabis, or working closely with a healthcare provider who's cannabis literate. I would say those are the major things to be aware of for especially older adults. Adults that are on multiple medications, I wouldn't just throw cannabis on top and hope. Right. A lot of older adults turn to cannabis because they've heard that they can wean off of medications. It's not a good strategy to sort of just sprinkle it on and see what happens. So people do get themselves into some trouble that way.
And I know we spoke of this once before too, but am I correct in saying that if you are using marijuana and you are needing a procedure and you're going under anesthesia, it's really important that you're honest with your providers about using, especially your anesthesiologist, because there might be a little bit more anesthesia that's needed.
Yeah.
And it might take a little longer for you to come out of the anesthesia state. So am I correct with that, Marissa?
Absolutely. Yeah. And that goes for anybody across the lifespan. If you're using cannabis, tell your anesthesiologist, tell your entire surgical team, because they're going to need to know. And frankly, from the surgical perspective, if you don't tell them, they're going to find out. So a lot of people don't understand what that means, that if you're not going to tell your anesthesiologist, if you're not going to be honest with them, a lot of people that have cannabis on board, they wake up during surgery, and that you don't want to do that. That is a really traumatic event. And then they're going to give you a heavy duty bolus, and they're going to put you back out, and you're going to be hanging out with some really, some post-anesthesia care unit nurses who really just want to go home.
Well stated. Yeah. I don't want to be that patient.
No. That's so important. We had Marissa at the hospital. We were interviewing a patient that came in, was just about to have a procedure done. This patient, kind of born and raised, lived half their life in Mexico, half in the States. And so some prescription records were only from what they had from the providers in the United States. And then we found out that this patient was taking regular benzodiazepines and other things that were prescribed in Mexico, and they were utilizing those here in the US. So I think what you called out there when it comes to cannabis really applies to everything, right? Every over-the-counter recreationalization of anything that can be a substance that can change or manipulate the way that other drugs are processed in your body. So important to be able to pull that across. And I love the highlights of all the ways that they kind of inhibit or induce, or the medical terms on what they do to other drugs, kind of in the system. When you have patients that are, we're talking about the inhibition and induction of some different medications, oftentimes I will see folks that come in and they're like, if I use a cream, it won't be as problematic because it'll have a more localized effect. Give us some of your thoughts there on, the modality that we're applying some of these chemicals to our bodies, cannabis in particular, or a CBD, THC derivative, whatever the case is, and your thoughts there on delivery mechanisms and people understanding safety and efficacy.
Sure. So if you're like using a topical if you're using a topically infused product, cannabinoids are they're big fat-loving molecules. They're not going to go through your skin. But that being said, there are a lot of products on the market that are transdermal. So they have been treated to go through the skin barrier, to go through into the bloodstream. And so there's some people, you very often, if you're in a dispensary and you're buying a transdermal product, you're going to know that it's transdermal because you're getting like a teeny tiny little patch for like $45 versus a topical, which is probably going to come in a much bigger bottle or a little container. But so yeah, in terms of topical exposure, we're not so concerned unless you're licking your arm or something like that, but you do want to be clear that it's not a transdermal product because that's totally different. So some of the other delivery methods, inhalation, smoking, vaping. Those are the two primary methods that people are using. Cannabis is, if you're smoking, you're inhaling heat and ash and products of combustion. You're inhaling a very chemically dense plant on top of that. Cannabis users don't necessarily have, there's been a lot of that's come out that cannabis users don't have, say, the high rates of lung cancer and COPD. But what cannabis users do tend to have is a lot of upper respiratory congestion, sore throats, very prone to diseases of the upper respiratory system, bronchitis, things of that nature. Other delivery methods, vaping, by the way, I call it the chemical poop storm. It is not. If you can avoid vaping, please do. There's not enough regulation. Cannabis is also a bioaccumulator. So a lot of things can stick to it, including heavy metals, molds, other sort of fungi, all sorts of things in the environment. And if that could be in your vape pen, and then you're just bringing it right into your lungs. And on top of the very high concentration of cannabinoids, which humanity has not had ever. We have not had these high levels of exposure ever. So very cute.
Marissa, what is the safest, do you think? If you had to say, what's the safest form?
Good question.
The safest form is eating it, honestly. But even then, you really want to be clear on like who's making it, where was it manufactured, there's a lot of people who are like even in dispensaries, this is probably a whole different podcast, but even in dispensaries, it's really there's not enough regulation to make sure that what is on that label is actually in the package. So I would say if in Massachusetts here, you can grow your own. If you can grow your own and then create your own oils and then create your own edibles or your own tinctures, I would say that's the best way to go. But if you can't do that, then again, you really want to know who you're buying the cannabis products from.
That's so insightful. And
go ahead, Kevin.
Go ahead, Donna.
So I'm thinking too about like dosing, right? And so how would someone know, or what's the recommendation when we are starting using cannabis? So say, someone's like, I want to try this for this purpose. How do they go about doing that? And how do they figure out, or who figures out a dose for them?
Start low, go slow. So start with the lowest dose possible and increase slowly. So what I typically recommend for inhalation is a good example. Now there are purposes for inhalation. I want to say that too. Like there are people that don't respond to edibles. It doesn't metabolize through their liver, and they're not going to get an effect for it. So sometimes inhalation is ideal, especially for people who are having like digestive problems and they can't use digestive tract. Inhalation is ideal. So I'll take that as an example. There are flower vaporizers. You put cannabis flower into it's basically these small heating devices. I recommend a ceramic little device. You put your cannabis in there, and the intention of the device is it's going to heat the cannabis flower up to a temperature prior to combustion, because it's going to break open the little resin sacs where the cannabinoids live. And then you're going to pull off that vapor. And you don't need to drag it down into your lungs. You know, a lot of this old stereotype stuff, you know, with the old hippies is you got to pull it down into your lungs, hold it there for as long as possible, and then exhale it. We know that you can just do a regular breath in and out, and that medicine is going to be delivered. When you're starting with it, do one, let that be your experience for the day. Next time, go ahead, do one, see how you're doing, maybe do two. I always say when you're starting something new, make sure that you don't have anything to do for up to 4 hours. Make sure that you're in a safe environment. Do not drive. You got to, it's an exploratory medicine. You really need to be able to sit and explore and experience to really understand how it's impacting you. For tinctures and other edibles, 1 to 2.5 milligrams is a good starting dose. For older adults, I would say start with the 1 milligram. And we usually recommend for older adults 1 milligram, and then increase every 3 days by 1 milligram until symptoms are controlled. For inhalation, you know, you can start with the 1, and again, just you really have to explore it. That's the difference with herbal medicine in general. You know, when you go to a traditional provider, they're going to give you the medicine, they're going to give you the dose, they're going to tell you when, they're going to give you all of that information. And that's why herbal medicine, plant medicine is so, it really turns people on their head after a while, because it's just so different than what we're used to in our medical system.
Sure.
That leads me to kind of the last question I had. As you kind of mentioned, Marissa, it could be an entirely different podcast. So hopefully it's one that'll be easy enough. When it comes to the dispensaries, you know, one thing that was rather problematic from lots of standpoints was this Ozempic craze. So the GLP-1s, the weight loss drug that was there right now is being taken advantage of by, I mean, I hate to say it this way, but every pill mill that's out there is going to find a way to get you Ozempic so they can make the margins on the individual drug. And it's happening throughout the US. There's new healthcare pipelines just happening because of it. Very similarly, especially where I'm at in Spokane County, you can drive in certain areas, and the number of dispensaries that popped up were just astounding, right? Just amazing. And I'm thinking to myself, Marissa, I'm sure a lot of these folks are exceedingly educated and have a patient mentality, you know, a connection with their customer. But others, I'm guessing, do not, right? And you mentioned, you know, knowing the individuals that are providing your care and providing your dosing and creating the products that you're consuming, all of those important pieces, until, you know, we can all work together and find a way to get cannabis utilization into, you know, as you mentioned, folks making their own and leveraging them with the assistance of their healthcare team, or those being utilized through a typical kind of healthcare pathway, which those aren't available for most places. And we're getting them from dispensaries, you know, right now. How would you recommend folks navigate that space to keep themselves and their loved ones safe if they're going to be utilizing cannabis?
You want to know your farmer. I mean, this is a plant that's grown, especially out in your area. Here, everything is grown inside. You know, but sun-grown cannabis is a big thing over on the West Coast, and people have to grow it. And so, you know, it is in most programs, most medical and adult use programs, adult use, by the way, is also known as recreational, but there you can go onto the cannabis program website, and licenses are going to be available for you to review, and you can do a little research into who's behind these companies. I tend to go for the mom and pops. These are people that were very often what we call, in the legacy market. They've been involved for decades. They really understand their plant. They're not a corporate run facility. Unfortunately, with the cannabis industry as it is we have a lot of corporate interests involved, and they're abundantly they don't care about the customer or the patient. They're paying off the labs that are supposed to furnish proof of what is in the product, and to show the public that that product is free of pesticides and other heavy metals and other contaminants that could be harmful. A lot of these companies on the corporate side are, they're operating in a really unfortunately dirty way. It's about getting cannabis in and off the shelves. So there's no, the movement still exists. So what I do recommend to people is that if you're healthy enough to go out and, hit an industry event, not a conference, but to go to a festival or, something like that. There's a lot of them, especially on the West Coast. There's a few of them here on the East Coast. You can actually meet people who are, they're the mom and pops. They're the ones that are really, they've been on the mission for a long time, and they really do believe in what they're doing, and they want to, provide the best product for people. What I guess what a lot of people can look for too is people that are in caregiver networks. Those are the people that there's a lot of programs across the country where people register to be caregivers, and they very often grow for just a handful of patients, or maybe even just one. And they're making a specific varietal or cultivar for a patient, usually with some kind of an intractable disease. And that's the network that you sort of want to tune into to find the high quality product.
Amazing.
So no particular labeling or mark quality assurance lab or any of those things that Don and I would typically recommend to a patient to see on their supplement bottles. Nothing like that currently established in the cannabis world that you'd recommend today.
There are people doing amazing things. I mean, I don't have a lab off the top of my head, because again, they're all part of whatever part of the constellation they're involved in, whatever state. That's they're all different. Every state has different regulations. Massachusetts, we have to specify what contaminants are in the product. Other states don't. Mm-hmm. They just have to specify the chemical breakdown. So
helpful.
Yeah.
Marissa, thank you so much for being with us today. And before we go, I would just love to ask one more question. And just what do you wish patients and healthcare providers, what would you wish for them to know or to move forward from this particular conversation that we had in understanding cannabis, or they had to do one thing just to move in this direction? Could you just share some words of wisdom?
Words of wisdom. For healthcare providers, I would say, and I understand the regulatory challenges, it is really, I get it. And for people that don't understand the regulatory challenges, basically it comes down to this. If any practitioner is with a facility that receives federal funding, and also at a professional license level, recommending cannabis can put them in the crosshairs. It could put them at the risk of losing the federal funding and also potentially losing their license. So that has been sort of what we've gone with for a long time. But I will say that, and Kevin, you showed the numbers earlier of how many people are using this plant. Yeah. We can no longer put our heads in the sand. We have to help the people that are in front of us. And I think we're doing a poor service if we're not looking at somebody's entire picture. If we're not looking at someone holistically. Mm-hmm. You're missing something. Someone could be using cannabis and non-Coumadin, and those things aren't compatible. So right. let's really look at how we can help people instead of saying I can't talk about that, because it's just putting people directly at risk. And for patients, I can't say enough that it's really important to work with cannabis literate health professionals. There's a lot of us that exist. We are out here. Work closely with somebody so that you can get on this journey in a safe way, so that you can learn at the level and the speed that you need to, so that you can have the most benefit and the least amount of risk.
Awesome.
Wow. Well said. So much incredible ground covered, Marissa. I'm so impressed by your depth of knowledge on all these individual subjects. It was very enjoyable. And thank you so much for your time today. And for folks that are listening, thank you guys all for being here, listening to Marissa's incredible information. We always appreciate your guys' attendance. Anything that comes up for questions, shoot them our way, and we'll see you next time on the MedList.